Let's get started because we've got a lot to cover today. So welcome everyone. We have people from all across Canada today and even some international join us. So thank you so much for taking the time to be with us here today. As you know, this week is Concussion Awareness Week in Canada. My name is Michelle McDonald and I am the CEO of Brain Injury Canada. I'm so privileged to be working with the amazing team at the Transcendent Concussion Research Program on this webinar. This has been a fantastic partnership in developing and delivering this webinar. We know the symptoms of concussion can be debilitating and affect every aspect of a person's life, so we thought we would focus on strategies from key experts to help people feel better. We have an amazing lineup of speakers, but before I pass it over to our amazing MC, Sydney Lowe, I want to give a quick special thank you to Kat Wilson, Jenny Dawson, Daniela Testani, and Gary Dillabow for their help in planning this webinar. It is an absolute pleasure working with his team. I also want to let you know that this webinar is being recorded and a link will be sent out after the webinar for you to watch it again at your own pace, to rewatch certain parts, or to pass on to anyone else that you think might be interested. Okay, on to the webinar. I am thrilled to introduce Sydney Lowe as our MC and speaker for the webinar today. I first saw Sydney speak at a public engagement event as part of the Canadian Concussion Network conference this past June in Victoria, British Columbia. Her honesty, candor, and resilience really stuck with me, and we are so thrilled to have her here with us today. So Sydney, over to you.
Thank you so much, Michelle. Welcome, everybody, and thank you so much for joining us during Concussion Awareness Week in Canada and Rowan's Law Day, which was yesterday in Ontario. Today's webinar is hosted by the Transcendent Concussion Research Program and Brain Injury Canada, and we're bringing together expert voices and lived experience to shine a light on important challenges after concussion. My name is Sydney Lowe, and I got a concussion in 2021, and I'm going to be your host this afternoon. I'd like to highlight that we have people joining us today from across Canada and internationally. Thank you so much for being here and taking the time to learn with us. So today I'm joined by three fantastic researchers from Ontario and BC who are experts in concussion and concussion management. Dr. Roger Zemek will be speaking to managing symptoms of headaches. Dr. Rébecca Robillard will be speaking about managing sleep, and Dr. Noah Silverberg will speak to mental health symptoms after a concussion. So we have a few housekeeping items that will keep our session running smoothly. We'll have 30 minutes at the end of the session for a Q&A. So please put your questions in the Q&A box at the bottom of your screen. We kindly ask that you avoid posting any personal medical advice questions. Our speakers are here to share research, strategies, and lived experiences, but they can't provide individual medical guidance. And this, like Michelle said, session is being recorded, and we will share the link afterwards on Transcendent and Brain Injury Canada websites. So to start us off, I'm going to be sharing my story of concussion and my experience so far with recovery. So I am a concussion survivor myself. I was hit by a car back in 2021 and was found unconscious in a puddle in the middle of the road. I don't remember that happening, but I do remember heading to the hospital in the ambulance and coming to the realization of what happened was definitely the scariest and most painful thing I've ever experienced. At the hospital, they gave me a whole bunch of tests and scans. I had some stitches sewn in, but I didn't have any broken bones, and I was told it was just a concussion. I was given a note for a week off work, and my sweet mom drove me home to bed, and no one really prepared me for how drastically my life was about to change. I was a counseling student when I had my accident, and this happened with just a couple of weeks left in the semester. So with the support of my instructors, I was able to finish that semester. It was all online, so I showed up each day with massive sunglasses on my eyes to cover up the screen. And I admit that I did fall asleep a couple of times in class, but they were so sweet and they just looked the other way. We all got a couple of weeks off after that for Christmas break, and I thought surely that would be enough time for me to rest up and get back to my life. But when I started up school again, my symptoms didn't get better, and they actually got way, way worse. And I ended up pretty seriously struggling with my mental health. I so badly didn't want to quit school. My family didn't want me to quit school. There was all this pressure to keep pushing, and so I did. And I pushed through because I couldn't handle the thought of failing. But in a sense, I was failing myself by completely pushing past my breaking point. Eventually, I had to succumb to the reality that I was not okay. My symptoms didn't just go away like I hoped that they would. So it's safe to say that I didn't end up going back to work for a long time, and I did end up taking a pretty good break from school. And for the next 3 years, I suffered with a whole grocery list of symptoms: constant headaches, hormonal chaos, deep dissociation, panic attacks, rage, night terrors. These were the kinds of things that made me question if I was losing my mind. There were times that I couldn't leave the house, times I felt like my body didn't belong to me, times I was terrified of my own thoughts. What was going on inside my brain made no sense to me. And trying to explain these invisible symptoms to the people around me was a daily struggle. My symptoms dragged on for what felt like forever. I was way beyond my window of tolerance every day. It took an unbelievable amount of energy to tend to my chores, my relationships, my friendships, my life, and with every short moment of presence came a long, intense, and necessary period of rest. It felt impossible to keep up with the world around me. I tried so many different therapies, both conventional and alternative. Especially early on, nothing seemed to really be working the way that I wanted it to. And all through that, I had one question that kept echoing in my mind: what is wrong with me? I asked it to myself, to my doctors, to my mom, to my partner. I wasn't just looking for a diagnosis, but I was desperate for someone that could explain what was happening to me. I wanted to feel better. I wanted to feel like myself again. The responses that I got didn't exactly help. The doctors just said, "So you have a concussion. These are your symptoms." My mom might suggest that I just needed to be more positive and keep pushing through. My partner would reassure me that there's nothing wrong with me. But when I asked myself that question, the answer that I heard was shame, really deep and painful shame. And none of these responses really touched the real ache that I was feeling. And the more I asked, the more hopeless and broken I felt. And I actually started to believe that I was losing my mind. Eventually, though, with through lots of time and with lots of time spent with my own therapist, something shifted. I realized that maybe I was asking the wrong question. Maybe what's wrong with me wasn't the question that was going to lead me out of this. So I started asking different ones. How am I feeling right now? What do I notice about how I'm feeling? What do these feelings and symptoms mean about me? What if this changes? What if this doesn't change? And can I make it through just this moment? And how? These questions, they didn't always have clear answers either. Sometimes it led to more and more and more questions. So naturally, I fully fell down the rabbit hole of concussion education and recovery. I spent so many days researching and asking Dr. Google my questions on questions on questions. I wanted to understand the science. I wanted to try every medical and alternative therapy possible. I was trying so hard to figure out what could support my brain so that I could finally go back to being myself. And to be clear, this pursuit wasn't useless. These therapeutic interventions exist to help people like you and me, and they do help a lot of people. And bit by bit, they helped me too. The issue was that I was going into it with this single minded hope that the next best thing was finally going to fix me, feeding back into that idea that there's something wrong with not just my brain, but who I am as a person. So when I started to shift those questions that I was asking, something opened up. And what used to be, did this fix me? Yes or no, became, I wonder what would happen if I tried this. I wonder what I would discover about myself. I wonder how it would make my body and my brain feel. And it totally went from this rabbit hole of shame and self blame and a problem needing to be fixed to this rabbit hole of curiosity and self discovery and recovery. The problem wasn't the therapies, it was the desperation I was bringing to them. I was chasing a cure, a fix, a way to go back, but recovery isn't about going back, it's about going inward. The healing started to slowly come from that sense of wonder, the curiosity, the passion to understand just a little bit more about myself and what I was going through. Our questions about ourselves often just lead to more questions, and that became the goal, to just keep asking. We're so complex, and our recovery and just who we are as people is always evolving. And while, yes, sometimes it feels important to find all the answers, especially when you're hurting and grieving, it's also important to acknowledge that sometimes the answers change, and what works today might not feel the same tomorrow. And also, what's not working now might feel much easier in the future. So, the goal is not just to figure yourself out, but to be interested in yourself, to take notice and to take note, but not necessarily attached to what comes up. It's been almost 4 years, and I've learned a lot about myself. I learned how to offer myself patience some of the time, and I slowly figured out a pace for my life that works for me most of the time. I learned that words fail me in overwhelming moments, and that art is a form of expression that I can always count on. I learned the importance of somatics and learning how to be in my body again after trauma. I learned that setting boundaries is one of the most important things while healing. And even though it feels really scary to say no, the peace that comes from it is so worth it. I learned that I actually am loved even when I'm not my happy and most productive self, which was news to me. And this learning hasn't stopped. Each day, I continue to ask myself those curious questions. And yes, sometimes that question is still what's wrong with me, but it has become a lot easier to pivot. And to give a little life update, I completed my counseling program and I opened up my practice. I also started offering respite care to families with kids with disabilities, which I love so much. And these jobs allow me a lot of flexibility, which I need to continue to take care of myself. I've built a really, really beautiful and loving relationship with my partner, Jose, and I'm finally in a place where I really feel like I can tend to all the important connections in my life again. Symptoms wise, some days are still hard, but I also have really, really good days, and a lot of them. I have a tendency to really try to take advantage of those good days and do every possible thing that I can. And I'm learning now that it's okay to just pace myself and be a little bit more realistic about what I can achieve in a single day. I'm still learning so much about concussions and the brain and my own recovery, so I'm here to listen and learn just like all of you watching. I spent a lot of time wanting to go back to the way things were before my accident, but to be honest, I am okay with it that things have changed in my life. I do actually like where I'm at right now, and that is not a place that I thought I would get to. Thank you so much for listening to my story and for Brain Injury Canada and the Transcendent Concussion Research Program for inviting me to share. Opportunities to share and be heard like this really bring a lot of purpose to an otherwise awful situation. So I encourage the concussion survivors who are listening to reach out to the concussion community, share your stories, and know that your experiences are so, so important and impactful for others to hear. Okay, it's time for us to do a little bit of learning now. So I'm going to introduce Dr. Roger Zemek. Dr. Roger Zemek is a pediatric emergency physician at the Children's Hospital of Eastern Ontario, where he is also a senior scientist at the CHEO Research Institute. He is a full professor of pediatrics and emergency medicine and holds a Tier 1 clinical research chair in pediatric concussion at the University of Ottawa. He is the past chair of the Pediatric Emergency Research Canada Network and the co-founder and scientific director at 360 Concussion Care. Dr. Zemek is the principal investigator of Transcendent, one of the largest and most comprehensive concussion research programs in the world. Internationally recognized as a leading voice in concussion science, he founded and co-leads the internationally adopted Living Pediatric Concussion Guidelines, and discoveries from his prospective multicenter studies have helped shape best practices for the diagnosis, management, and prediction of concussion recovery.
Thank you so much, Sydney, for that. Well, first of all, for your lovely testimony and courage in sharing your story. And what you feel is something that we see all the time in concussion care. So it is an honor and privilege to speak to all of you today. And hopefully we can leave this together with a better understanding of headaches following concussion. So I want to start with a little story. I want to start with the story here of this young woman. I want you to all imagine you're 18 years old. You also are now in your first year university, living away from home for the first time. Your world is full of possibilities. The biggest stress in your life is your first midterm next week. This is Maya. She's a first year student, but 5 days ago, her world was turned upside down. She was simply just walking back to her dorm, slipped on a patch of wet leaves, and she fell, striking her head against the pavement. She didn't lose consciousness, but immediately felt headache. She was dizzy, and her friends said she was really wobbly as they helped her up. That was 5 days ago. Today, Maya is preferring to stay in her dorm room. Her headache is still bothering her. She still sometimes gets dizzy when she stands. She's having a hard time falling asleep, and the screen of her laptop feels like a bright spotlight into her eyes. And the noise and the normal joyful sounds of the residence dining hall, the trays clattering, the people laughing, are now overwhelming. She's worried. She's really worried. Her concussion 2 years ago took months to get back to normal. And now, with her midterms next week, all she's thinking is, I can't fall behind. I can't go through that again. I can't study with this headache. So, what can we do to help Maya feel better quickly and as safely as possible so she can get back to school and life? Like Maya and Sydney's real life story, these experiences are not unique. Headaches are the hallmark symptom of concussion, and the numbers show how widespread headaches are. They're the most frequently reported symptoms, and it occurs in most children after concussion, even more frequently in adolescents, and even in adults, nearly 92% report headaches shortly after concussion. It's not all bad news. There have been some studies in youth with concussion that have followed them for years, and there's a recent study that just showed there's no higher risk of long-term headache in those who had brain injuries compared to those who were matched. But before we get into long-term outcomes and to talk about treatments, we better need to first understand what causes the headache itself. And it's not what most people think. The brain, the neurons in your brain themselves do not have pain receptors. Those neurons cannot feel pain. The pain from your headache comes from the sensitive structures around your brain. A concussion is a functional injury that leads to a cascade of metabolic changes in your brain. This process then irritates the pain-sensitive structures around your head, such as your blood vessels and the protective coverings around your brain called the meninges, and certain nerves in your upper spinal cord as well. This triggers inflammation, and that activates sensitive nerves, such as your trigeminal nerve, which sends the pain signals which we now experience as headache. Furthermore, tight muscles around your head and injuries to your neck can trigger what we call tension-style headaches, or headaches that are due to neck injuries called cervicogenic headaches. And finally, stress, often triggered following a concussion that triggers a fight or flight state, can even lower pain thresholds and make us more sensitive to pain. I want you to think about how we manage headaches using an analogy. The small, manageable headache that might appear days after the injury is like a small campfire. It's contained, and with the right actions early, we can hopefully put it out. However, if that campfire is ignored or the treatments are not properly managed early, it can spread. That small fire is now a raging forest fire of persistent, disabling symptoms that are much harder to put out. That's why our approach has to be proactive. So how do we identify the headaches that are most likely to become forest fires and prevent that forest fire from happening? Recent research, including studies that I've been involved with, has shown that the type of headache people experience is a powerful predictor of their eventual recovery. So we don't just ask, do you have a headache, or what is your pain number? We should be asking, what kind of headaches do you have? What are your triggers? Have you had headaches in the past? Have you had migraines in the past? What are the things right now that are making your headaches worse? And importantly, what are the things that make your headache some relief? Are there findings that we can see on our physical exam that give us clues? And all these things together can help us what we call phenotype the headache. That is the description of what that headache looks like in that person. So let's talk about a few phenotypes right now. There's post-traumatic headache, which is just a general term. It's an umbrella term for any headache that occurs following a head injury. Then there's migraine types of phenotypes. And these are specific types that are more classic to a classic migraine. So things like an aura before it, light sensitivity, worsening noise sensitivity, maybe even some motion sickness, or even nausea. Then there's that cervicogenic headache that I talked about that may be more neck related rather than head related. And these distinctions can be changing how we think about individualizing headache management to move to a future of active, personalized, targeted strategy. So good lifestyle habits are the foundation of any recovery plan. I can't take credit for this. It's my longtime collaborator and Transcendent co-investigator, Rébecca, who's at Boston Children's at Harvard, who says the best way to treat a concussion early is listen to your mother. So drink plenty of fluids, eat consistently healthy meals with protein, take your vitamins, don't drink too much caffeine, and don't drink alcohol. Get plenty of sleep and exercises. And these are just foundational lifestyle habits that can at least create the right environment to start your brain recovery. Later in the session, Dr. Robillard is going to be going into much greater detail on that importance of sleep. And Dr. Silverberg is going to be talking about other ways in which we can put our brains and our minds in the right state to optimize recovery. But let's talk a little bit more about some of these early interventions we can do to make sure that fire doesn't spread. For decades, standard advice for concussion was to be cocooned, rest, dark, quiet, avoid any activity until your symptoms were gone. We now know that this is outdated evidence, and home jail can actually be harmful because prolonged rest can be counterproductive It could lead to physical deconditioning. It can lower your mood and worsen your anxiety. It can delay your reintegration into school or work or social life. That's so crucial for recovery. One of the other keys is exercise, but not just any exercise. We don't want to do anything high risk. That's why there is a thing like Rowan's Law. But it's finding the right Goldilocks dose of aerobic exercise, because aerobic exercise is medicine. So how do we do this? We do this using standardized safe exertion tests, such as the Buffalo Concussion Bike or Treadmill Test. We put people like Maya on a treadmill or a stationary bike, and then she would exercise at increasingly gradually higher intensities. The providers carefully would monitor her heart rate and her symptoms and looking for a very specific point. It's not the onset of any symptoms, it's passing a threshold in which the symptom exacerbation is more than mild. That's also a point at which we measure that heart rate, at which point those symptoms get worse. It's not about then pushing through the pain to get to the maximum or not getting pushing enough. It's finding that Goldilocks. What is the limit of what her threshold is? These things can be done safely within a day after the injury. And if people don't have access to this bike test, people can do this on their own at home, starting with walking. And then people do a threshold progression using just a simple rule. So if thinking about a 10-point scale where the 10's the worst pain and 0 is none, you're allowed to start. Even if your pain is not 0, you could start with a 3. And you start your walk and you go to 4 and then you go to 5. If you get more than 3 points or more, it's time to take a break. Then try again in a bit. This is now talking about active but individualized management. And the goal is not passively waiting for the symptoms to disappear, but using exercise to help the brain heal. Let's talk about the neck. We all have to remember, whatever led to our brain accelerating and decelerating that injured the brain, that caused the concussion, can often injure the neck too. This is known as whiplash, and it's a common cause of headache. It can also contribute to dizziness, disrupt sleep, and all these things feed into each other, creating a vicious cycle. When this headache from the neck, the cervicogenic, happens, treatment often focuses on restoring neck mechanics and reducing the sensitization that's occurring in the neck. Physiotherapists sometimes will combine manual techniques, which are gentle joint or soft tissue remobilization, giving home exercises to improve the strengthening. That could be range of motion work or stretches or strengthening, and also just thinking about big picture prevention, making sure posture, ergonomics, and of course the exercise as well is all happening. Physiotherapists also realize if the headaches are triggered by visual or dizziness problems, they can also work on vestibular or oculomotor rehab to be added. When symptoms persist, sometimes doctors also can do targeted treatments. These are more advanced and you need a specialist to do them, but they could do nerve blocks. All of us may have gone to the dentist and needed to have dental work and received lidocaine. Well, we could do lidocaine to numb some nerves to reduce a pain source. That could be done with an injection somewhere on the neck. It can also be done by dropping some lidocaine in the nose, and our Transcendence team's just finishing up a study on that. Additionally, we could use things like Botox. It's not just for cosmetic. It can actually, what it does by paralyzing temporarily those muscles, it can help give those neck and shoulder overactive muscles a chance to reduce their spasms and reduce a tension that can last weeks or months, and act as an adjunct to allow people to continue the other treatment regimens. The best way to treat headaches is not let one happen. So let's talk about simple things, prevention. There has been some evidence that may show some benefits of daily supplementations, things like riboflavin, which is vitamin B2, magnesium, which is a salt, and omega-3 fatty acids may help in reducing the frequency of headaches. But not all headaches can be prevented, and people do still have pain that breaks through. So how do we manage that? Let's keep it simple. People should start with over-the-counter medications like Tylenol, which is acetaminophen, or Advil or Motrin, which is ibuprofen, and that's the first line of defense. Naproxen, such as like Aleve, is just like ibuprofen. It's a non-steroidal anti-inflammatory, but rather than being short-acting, which also means it wears off quickly, it's lasts longer. And I personally find that that's a good one to transition to quite early, usually within a week. It's really important that people avoid opioids for headaches. They are less effective than some of the over-the-counter, believe it or not. And we are all too well aware of the risk of dependence of opioids. But there's also a limit. Once people are using over-the-counter pain relievers for more than half the days a month, can actually kick off a nasty cycle called medication overuse. So what do we do next? For the headaches that are occurring more frequently, more severe, the duration throughout the day, maybe interfering with quality of life, or have migraine-like features, doctors or nurse practitioners may consider additional prescription options. There are ones that are abortive, and ones that work for abortive are things like triptans. And some of those can be sprayed in the nose, sometimes they're pills. And then sometimes there's preventative medications. Things like amitriptyline can help reduce the number of days a week with concussion. And one of the things I love about medications like amitriptyline, and Dr. Robillard can talk about that as too, is we use the side effect as a bonus. The side effect of amitriptyline is it makes you sleepy. So maybe people actually get benefit from the sleep, not from the medicine itself. But there's so many factors that go into what prescription choice is right for each patient. And every patient has to balance a benefit with their side effects, and those decisions need to be shared with their provider. So as part of Transcendent, we want to make sure we give the right treatment to the right person at the right time. That's called precision care. And we are trying to study better ways that can help determine, using advanced tests, what are things that may determine what's the right treatment. So we are looking at things called autonomic dysregulation. That's injuries to the fight or flight state, using a tilt table, looking at eye tracking. We're doing advanced MRI pictures and even fluid biomarkers that even have the potential to look at genetic patterns that can figure out which treatment is the right one for the right people. And Sydney talked about lots of treatments, but there's always new discoveries. And some of the stuff that we've learned from migraine may help with post-traumatic headaches and post-concussion headaches as well. The field of migraine showing some promise on things called neuromodulation devices, which could be either small electrical signals on the arm that are placed or on the forehead that can help reduce migraine headache frequency or even immediate relief, and may have some roles in concussion. And there's new medications. This is a handout from the Migraine Canada group, and it's downloadable offline. There are medications called geptans, or that block a thing called the CGRP, which is a calcitonin gene related peptide. We're not going to get into the science, but it's in the migraine pathway, and they can be very effective. And while they're not standard of care for concussion, there is very promising research that's ongoing, including as part of our Transcendent study. Just very briefly about Transcendent, since we mentioned it, you may not know what it is. It's a program supported by the Ontario Brain Institute in partnership with CHEO Research Institute and 360 Concussion Care. We've already enrolled 2,000 people with concussions, and not just the commonly studied youth athletes or the people with military injuries, but all people. People like Maya, people who fell, people who've been in a motor vehicle collision, people who've been assaulted. And we're doing lots of sub-studies. And for those of you who want to learn more, I would love you to learn a bit more about the things we're doing. So in summary, listen to your mother. At least put your brain in a state to optimize your own recovery with additional help. Start being active. Avoid that home jail. Let's make sure that fire doesn't become a forest fire, because it takes a lot more to put out a forest fire than a campfire. And we're really working to make sure we get the right treatments for the right person at the right time. I know we covered a lot very quickly, and we got some fantastic experts to move to, but if you want to learn more, I put some QR codes, and as Michelle and Daniela mentioned earlier, we're going to make sure we get the ability for you to get slides and re-recording afterwards. So scan those QR codes if you want to learn more. And I look forward to hearing your questions during the chat and to be discussed after the presentations. Thank you again.
Thank you so much, Dr. Zemek. It's so important and useful to understand the science of what's happening when concussion survivors are having those headaches. And the precision care you're offering is really awesome. So thank you so much for the work you're doing. It's my pleasure to introduce Dr. Rébecca Robillard. Dr. Rébecca Robillard is a clinical neuropsychologist and professor at the University of Ottawa and co-chair of the Canadian Sleep Research Consortium. She leads a research team focused on understanding how sleep and mental health are connected, especially in conditions like depression and post-traumatic stress disorder. Her work looks at how improving sleep can support mental health and recovery, and she is developing new approaches to sleep treatment that go beyond standard care. Through her work, Dr. Robillard aims to find better ways to improve sleep, strengthen mental health, and enhance quality of life.
Thank you for this nice introduction. And it's an honor and a privilege to be talking to so many people around the country about sleep. Hopefully you can see my slides now. So I hope that by the end of this session, I'll be able to convince you that sleep is a strong ally for brain health and for recovery as well. So in this session, we'll get an overview of how sleep works and what often happens after a brain injury. We'll talk about what healthy sleep is and what we can do to enhance our sleep health as well, and when it might be time to seek formal treatment. So the first thing I want to talk about is that there's major individual differences in our sleep needs. And unfortunately, there's this myth that everyone should get 8 hours of sleep. While in fact, sleep needs are mostly determined by genetic factors and a lot of other personal kind of characteristics, including, for example, medical conditions. And while indeed there's a large proportion of the population that does prefer to sleep 7 to 8 or 9 hours each night, there's also a smaller group of people who need only 4 to 6 hours of sleep. And there's other people who at the other end of the spectrum need more than, 9, 10 hours of sleep to feel good during the day and to feel rested. And of course, another important factor is age. Like we don't have the same type of sleep depending on where we are on the age continuum. So younger people need much more sleep, and our sleep duration tends to decrease as we're aging. And I think that this is important. I'm just mentioning that because people who are short sleeper don't necessarily have insomnia or sleep disorders if they function well during the daytime and if they're, don't see any effect on their health. I think this is important because we see now, more and more people kind of coming to sleep clinics and being worried and stressed and anxious because they sleep only 6.5 hours each night. Well, if that's your kind of natural rhythms, then that might be okay. So I think we need to kind of get realistic expectations about our sleep and not worry too much about it, though it is really important, as I will continue talking about. Another important thing, aside from the quantity of sleep, is the quality of sleep that also really matters. So during a typical night, we go through different sleep stages. Stage 1, for example, is the period when we're falling asleep, we're transitioning from wakefulness to sleep. It might be a period where you start having some imagery. We might have some twitches in our body. That's totally normal. There's stage 2 sleep, which is still fairly light sleep, but is really important for a lot of cognitive, intellectual functions, as well as body function. For example, we'll be talking about its importance for learning and memory. And stage 3 sleep is often referred to as deep sleep, is one of the stages of sleep in which we're having most of the recuperative functions of sleep. That's prime time for the secretion of growth hormones. And that's why, like when we're younger as well, we tend to have like those cramps mostly at night as we're growing up because our body is secreting a lot of that growth hormone. But that hormone is also very important across the lifespan as our body is healing from various injuries injuries that we might have sustained. It's also very important for the immune system and also for different elements of learning and memory. And then you might have heard about REM sleep or paradoxical sleep. So this is often the stage of sleep in which we dream, or we have these kind of vivid experiences of things that we recollect as dreams in the morning. So during that sleep stage, our body is typically paralyzed, although our brain is very active, very similar to what we would see during the waking state. And we know that paradoxical sleep is very important, notably for emotional regulation and also muscle memory. And so we cycle across these different sleep stages multiple times a night, and we would have about half of our night that would be in what is considered light sleep, whereas a quarter would be in then deeper sleep and paradoxical sleep. So I guess I want to kind of highlight the message as well that all those sleep stages are really important. It's not because it's light sleep that it doesn't matter, and we need just absolutely a lot of deep sleep. Now, how is sleep regulated? So there's two main mechanisms that are at play. The first one is very simple. It's just the fact that we're building up more and more sleep pressure with the time that we spend awake during the daytime. And I want to kind of stress that because this is something that we can actually measure in the brain. We can measure some indicators of that sleep pressure that builds up with the hours that pass. And that is linked to then better, deeper sleep as well when the night comes. So it's important to have active days in order to have restful nights. The other aspect that I want to highlight is that biological clock that regulates our sleep-wake cycle, but also a range of other biological functions across the body and the brain, including the secretion of our hormones, our temperature regulation, heart rate. So lots of functions are kind of dictated by that biological clock. And that's one of the aspects as well that we are seeing can be affected following brain injury. We know that this biological clock, the center is really located in the brain. And that can make it so that we might feel after a brain injury a little bit like jet lag, like as in, you're not hungry at the right time, you're struggling to fall asleep at the right time, not too much energy, and during the daytime, difficulties to activate, but then during the nighttime, you might have more energy or periods where you feel more awake. So that might be a cue that that component of sleep regulation that pertains specifically to the biological clock could be affected. So what else do we see after a brain injury? There's studies, if you want, that have looked at all the work, the research that has been done, that have been documenting a decrease in sleep efficiency after a brain injury. So that means that sleep becomes a bit more broken down, like more awakenings during the nighttime. However, there are also indications that we see a reduction of lighter sleep and an increase in deep sleep. So almost as if our body is taking kind of a natural defense mechanism to kind of promote healing through some of the mechanisms that happen during deep sleep. However, we also see some increases in the occurrence of sleep disorders, and these are varied and diverse. So we're not just talking about insomnia, which I'm sure everyone knows about, but also things like sleep apnea. So this condition where people stop breathing during the night. And I want to highlight that because sleep apnea is oftentimes an invisible disease as well, because you don't necessarily realize that you have these gaps in breathing during the nighttime. Your partner might or might not realize, but that's where, we'll talk about some of the signs that the condition might be there and that it would be important to get assessed and get treated. We're seeing also some circadian rhythms, sleep disorders, so disorders that are more focused on that biological clock that we talked about, as well as sometimes hypersomnia or increases in sleepiness and somnolence during the daytime. And some of these sleep disturbances have been linked to, in the context of brain injury, to worse symptom severity, to longer recovery time after the injury, as well as reduced thinking skills across various cognitive domains. But I want to say the good news is that for most people, we'll see that after the injury, sleep will progressively increase in the weeks that follow. These are results from some of our studies that are currently under review, showing that from week to week, sleep does improve overall in many people. And I'm highlighting that because, you know, straight after an injury, of course, we want to protect our sleep because we know that it's working for us in terms of doing some recovery in the brain, and helping our health globally. But we might need to be a little bit patient as well, as in it is normal. It is to be expected that the sleep might be a bit disrupted in the acute stages, but chances are that it'll get better with time. And I'm highlighting that because oftentimes if we talk about insomnia, for example, or chronic insomnia, what makes us kind of go down that rabbit hole is oftentimes not the sleep disturbances per se, because this happens for everyone. However, it's how we react to these sleep disturbances that really kind of can push us over the edge and make them chronic over time. Now, I want to quickly give you some hints about how sleep is important for brain health. Recently, there's been that discovery that, you know, although during wakefulness we have a progressive accumulation of certain neurotoxins that can be not so good for the brain, during sleep we see that the space between brain cells actually expands, so that the brain fluids that flushes these toxins away can kind of increase. So we see that there's 60% of the brain cleaning that actually occurs during sleep. And I'm really looking forward to see more research being done in terms of how this specific mechanism could come to play in terms of some of the benefits for sleep in terms of recovery after brain injury. At the more thinking skills levels, we know that, for example, after a period of sleep, we have much better memory performance than after a period of wakefulness. And that's notably linked to this very tiny kind of feature of brain activity during sleep, sleep spindles, that we see actually increasing as well in sleep periods that follow learning. So we know that basically sleep helps us perform better in terms of our mental performance during the daytime, but also how active we are during the daytime will have some influence on the quality of our sleep and some mechanisms in the brain during our subsequent sleep. Even we see now with neuroimaging techniques that certain parts of the brain, for example, that are activated when we're trying to memorize and learn something, they get reactivated during sleep as well. So really, sleep is helping us to continue process information during the nighttime so that we can have better days as well. Very quickly, I want to touch about that bidirectional relationship between chronic sleep loss and mental health. So when we don't have good sleep, of course, we tend to have low mood, irritability. We tend to see life with a bit more of a negative lens. We tend to ruminate more, so having these kind of negative thoughts that go around and around. And I think that this is important because both sleep issues and also some of these mental health difficulties are commonly seen in concussion. And oftentimes people ask, like, what comes first? And my quick answer is, I don't care, because I know that when we do fix sleep, when we do help people sleep better, then we see improvements in terms of some of these mental health outcomes. So I think that this is the key message that I want to again stress, is that looking after sleep and making sure that we get good quality sleep as well is a strong ally for our mental health as well as our brain health. And this is just to give you an example. I don't want to get too nerdy here with the different brain structures, but you might have heard of the prefrontal cortex, that is more like the rational part of our brain. And during the daytime, this part is very, very active, and it kind of talks to that other structure that you see here, the amygdala, which is heavily involved in kind of emotional responses and especially stress responses. And oftentimes during the daytime, the more rational part of the brain will come and kind of tone down or rationalize a bit the emotional parts of our brain so that we can make sense of what's happening. We can kind of come up with coping strategies. We can put things in perspectives. So that's what happens in the daytime. During the nighttime, what we're seeing is that the frontal lobe, the anterior rational part of the brain, tends to kind of fade out. It slowly goes to sleep even if we're awake, whereas the amygdala kind of increases its activity, and the two don't speak to each other. So it's the perfect condition for our brain to kind of ruminate, for our thoughts to kind of go in circles and get worried and get stressed and get anxious. And why I'm trying to emphasize this here is just so that it is clear that to you that during the nighttime, it's probably the worst time to be kind of trouble solving, trying to kind of come up with solutions or resolve some issues. Like your rational part of the brain is really not really equipped to support that kind of process, and the emotional part of the brain is a little bit hyperactive. So just kind of knowing that if you feel like, you know, your head is hitting the pillow and then the little hamster starts running, just kind of realizing, oh, it's just my amygdala. It's kind of overactive. That's okay. That's normal. My frontal lobe is not there to back it up and to reassure it that everything will be okay tomorrow morning. So I'm just going to put those worries on the bedside table. They'll be waiting for me tomorrow morning because right now is not the right time to think about this and ruminate, because it'll kind of easily create some vicious cycles. So now, what can we do to try to improve our sleep? I want to focus on this new framework that focuses on sleep health. So rather than focusing on pathologies and disorders, the scientific community in sleep has been working to identify 6 core domains of sleep health that we know are all linked to better outcomes in terms of mental health and physical health. And where I think that this is interesting is that this is totally independent from the presence or the absence of sleep disorders. So whether you have some sleep disorders or not, you can take some guidance from these core domains to derive some actionable things that we can do to improve our sleep health. So the first aspect here is regularity. And this is really, really important. So prioritizing a regular, constant routine that will help us get more quality sleep, not just better quantity sleep, but also the quality of it is intrinsically linked to regular bedtimes and wake up times. And of course, it's not because we go to bed that we will fall asleep immediately, but the wake up time is something over which we have more control. So this is something to kind of keep in mind, trying to reduce the gap from day to day and weekdays and weekends to have better regularities. Another aspect is satisfaction. So I think, again, not everybody will have the same type of sleep and the same amount of sleep. We need to avoid comparisons with our neighbors or our bed partners. We need to keep realistic expectations and maybe be patient as well if we're recovering from injury. And also practice acceptance. Like if we cannot change our sleep right now, we should work on accepting it and not kind of dramatizing it a little bit, because again, how we react to these sleep issues oftentimes could bring us down to chronic issues down the track. Another aspect is alertness and sleepiness. And I think that the little hint here would be to plan at least an hour if we can to relax before going to bed. Like oftentimes we go in kind of busy schedules with work, family duties, dinner, and and then, you know, whoops, we go to bed and we expect to fall asleep straight away. Like set some time for yourself to really wind down, some me time where you can do some quiet, enjoyable activities and kind of get in the zone of feeling relaxed and kind of having an enjoyable moment. And one tip about that as well could be, like, we often use alarms to wake us up in the morning, but we could also use an alarm to say, like, okay, it's now to start time to start my bedtime routine, so that we don't get kind of caught up in the busy days. Another aspect is the timing. So if your schedule is flexible, and adjusting our bedtimes and wake up time to what our natural body clock kind of dictates. So some of us might need to go to sleep to feel optimal and better, might need to go to sleep earlier. Some of us might need to go to sleep later. This is perfectly normal. So we need to listen to our own body. And I know that light exposure is something that can be sensitive after concussion, but this is one of the primary signal that is sent from the environment to our biological clock to dictate when we should be awake and asleep. So that might explain some of the difficulties that we might experience with sleep. But there's other ways that we can strengthen the biological clock signals, notably with having regular meal times, having regular periods where we exercise, we get out, and socialize as well. Those are all signals that help anchor and strengthen our biological clock. And then another important aspect is continuity. We talked about that sleep drive. So by being physically active during the day, we can increase that sleep drive and make sure that our sleep is more continuous, less broken down afterwards. And trying to challenge that belief that we should be asleep 100% of the time. This is actually a bit worrying. If we're asleep all of the time, something weird is going on. So it is normal for everyone to kind of wake up a little bit during the middle of the night. Again, it's how we react to it that can be a bit of a slippery slope. And now in terms of the duration, again, not everybody needs the same amount of sleep, but if you're not sure what your own sleep needs are at a given time and point, you can start with that average, like 7 to 9 hours, and then go to bed and wake up at the same time every day for at least a week, then assess how you feel and then make some adjustments, and then track patterns of how you're feeling during the daytime to find out what is the right amount for you. And I wanted to just quickly give a few hints of when it might be time to consult, because these tips are helpful, but sometimes they're not sufficient if we have signs of sleep disorder. So if you have persisting difficulties to fall asleep or stay asleep that start affecting your ability to function during the day, and this has been going on for more than a month, it might be a sign that you've got chronic insomnia and it is time to consult. If you're feeling excessively sleepy during the daytime, even if you feel like you have slept enough during the nighttime, that might be signs, for example, that you could have some underlying sleep disorders like sleep apnea, where you're not realizing that your sleep is getting broken down during the night because of respiratory problems. And there's no million solutions to that issue. There is a need to go in a sleep lab and undergo some tests to get assessed. Same thing if you're being told that you stop breathing during the night, that you're gasping for air during the night, those might be signs of sleep apnea. Some people feel some discomforts in the leg during the evening and as they're going to bed and trying to fall asleep. So those could be signs, as well as some sleep pathologies that could be treatable. And of course, oftentimes after trauma, some people experience nightmares. If you find that those stick around, it's helpful to know that there are some treatments dedicated for nightmares that work pretty well as well. So it's worth consulting a professional. And I just wanted to highlight that for insomnia specifically, including insomnia that becomes chronic after a brain injury, the first line recommended treatment is called cognitive behavioral therapy for insomnia, or CBT-I for short. This involves no medication. So just by making some behavioral changes, we're able to address some of the perpetuating factors that maintain insomnia over time. So if you want to learn more, I'm putting our website address here. And also we are offering the CBT-I via different research projects. We're currently partnering with lived experts who have sustained concussion to design a specific CBT-I treatment that's adapted for that context. So if you're interested, by all means, do contact us, get in touch about that. And sorry, I think I ran a little bit over time, but I'll stop here.
Thank you so much, Dr. Robillard, for sharing such interesting data on sleep. It's so fascinating how our body puts in so much effort to adjust itself and its sleep patterns to help our brains get better after injury. So thank you so much. And our final speaker, we have Dr. Noah Silverberg. Dr. Noah Silverberg is a clinical psychologist and researcher who specializes in brain health, particularly concussion and traumatic brain injury. He completed his PhD in clinical psychology at the University of Windsor and his clinical training in Vancouver. Before joining the University of British Columbia's Department of Psychology in 2020, he worked for more than a decade at British Columbia's main rehabilitation hospital, where he also led a team that focused on brain injury research. His research explores how thoughts, emotions, and coping styles affect recovery after a concussion. By studying these factors, he aims to create and test new treatments to help people recover more fully. Dr. Silverberg also is interested in how memory and thinking skills are assessed and ways to improve rehabilitation and how to better bring research into everyday clinical practice.
Thank you for that introduction, Sydney, and terrific talk so far, both of which alluded to mental health. And so my job for the next 15 minutes or so is just to dive into that a little bit more and the intersection between mental health and concussion. So I'll use my time today just to share with you 5 things we know about this topic. So we can think about coping as one aspect of mental health, and it's become clear that how people think about and cope with their symptoms can make a difference for their recovery from concussion, for better or worse. And we're better understanding which coping strategies matter and how they work. I'm just going to give you one example looking at fear avoidance coping, and I'll walk you through how this works, how it's an intuitive but actually unhelpful approach to coping, using the example of developing a phobia of dogs, which is something we all probably can relate to. So naturally, when we find situations or activities aversive, anxiety provoking, uncomfortable, we tend to stay away from them. Or if we find them ourselves face to face, we kind of move away from them. And that makes perfect sense. It's helpful in the short term, makes us feel less anxious and more safe. But if we keep doing that over the long term, in the case of dogs, we might actually develop a deeper fear of dogs over time and pretty soon restrict our activities to the point where we can't go anywhere out of concern that we might run into a dog and so on. And it's pretty easy to end up getting stuck in this kind of pattern over time. So a similar kind of story with avoidance coping can play out after concussion, where we know in the early days, symptom spikes, flare-ups can be uncomfortable or even scary. And so people tend to avoid doing things that might make their symptoms worse. Again, makes sense. And only becomes a problem if they keep doing that and do more of it over time and maybe expand the range of things that they're avoiding to include even things that, might possibly hurt their brain. And so they end up being very cautious, scared to do things, which doesn't give our brain an opportunity to adjust. That's of course how neuroplasticity happens when we let give our brains a challenge. And so I think the lesson here is that we need to recognize and break out of this kind of avoidance trap and gradually get back to our activities is one way that coping can get in the way with recovery. Something else we know about this topic is that mental health problems are very common, more common than they are in the general population, and even more common than people who have another kind of injury to their body, like they break a foot or shatter a hip or something like that. And there are probably some reasons why mental health problems are more common, especially common after concussion. One is that the brain systems involved in emotional regulation themselves may be injured. We know that an injury can be a stressful event, some circumstances more than others, like a major car crash or an assault or something like that. And just the symptoms and life disruption in the days and weeks following injury can be a major source of stress. So as many as 1 in 3 people after concussion can have significant mental health symptoms in the months following. And many of these people will have a full-blown mental health condition, one that they would get a diagnosis for if they went to see their doctor about it, something like major depressive disorder or post-traumatic stress disorder or an anxiety disorder. Another thing we know is that mental health problems amplify symptoms that are already there after a concussion and can even create new symptoms that can be mistaken for quote unquote concussion symptoms. So here's an example of some data that we've seen where people with mental health problems, in this case depression, have lots of so-called concussion symptoms, even more than people with concussion. And also you can see here there's a kind of amplifying effect that when people have both concussion and depression, they have a whole lot of symptoms. The most obvious reason for why that is because a lot of these symptoms overlap. If we put together the symptoms of depression, symptoms associated with stress, and sort of typical concussion symptoms, you can see that overlap clearly, that most of what we refer to as concussion symptoms are not unique to concussion. And so the implication here is that at least some part of what many people are experiencing after concussion are actually the amplifying effects of mental health. And recognizing this, I think, gives us ideas about how to help people recover better from concussion. So I would capture at the top here what may be kind of an intuition-based model. Like it makes sense that a concussion causes mental health problems, and to some extent that's true. But what we know now from the research evidence is that this relationship is actually bi-directional, it goes both ways, and if anything is probably stronger in the other direction, where mental health problems tend to precede and complicate worsening concussion recovery. So some good news is that we can pretty quickly get a sense of how people are doing with their mental health and figure out if they need kind of professional help, referral to a specialist, or something less than that. I'll just show you a couple examples of these brief questionnaires that can do this. I understand there are some health professionals in the room, so I'm speaking to you especially here. This is the PHQ-9, which just asks about some different symptoms that people have. And some clinicians I know get concerned about, well, how do I know if the symptom is because of concussion or depression? And my answer is, don't worry about it. It turns out when you just count up all the symptoms that people have, that's how you'll be most accurate at determining whether they have depression or not. Here's another example of a short questionnaire. This one for screening for post-traumatic stress disorder. Only 5 questions. Takes a minute or two. And we know that these questionnaires work pretty well. Again, this slide is for the health professionals. If these graphs, these ROC curves on the right mean something to you, the short story is they work really well at identifying people who have been diagnosed as having a condition or not based on a more complete mental health assessment. The last fact I want to share is that mental health problems are treatable, in fact, in much the same way as we treat mental health problems in people without a concussion. And generally speaking, we're talking here about structured talk therapies, like cognitive behavioral therapy. So similar to what Dr. Robillard mentioned, cognitive behavioral therapy can be used to target sleep problems, can also be used to target anxiety or depression or other things. And typically done with a psychologist or a counselor. And then there are medications often prescribed just by a family physician or by a psychiatrist that can be helpful as well in general for mental health, but also following concussion. So as far as what the person trying to recover can do, I think one of the messages here is to maintain, or if possible, gradually increase your engagement in activities that you need and want and enjoy doing. So we're talking about kind of stepping out of room jail, as Dr. Zemek referred to it as, and back into your life. This is necessary for brain recovery and also helps to guard against isolation and depression, other kinds of psychological complications. Making use of your social support, taking care of your general health. Again, some of the things that Dr. Zemek already mentioned around, regular exercise, things that are good for our heart are good for our brain. And of course, that's the source of mental health. We want to avoid making things even worse. It reminds me of, I think it was a Chris Hadfield quote, that there's no situation so bad that we can't do something to make it even worse. And using alcohol and drugs to cope with stress is, I think, a good example of that, and reaching out for help if you're struggling. And again, for the health professionals in the room, if you want to learn more about some of the topics that I've touched on here, here's a relatively recent review article that goes into more depth about many of these things. And I will stop there.
Thank you so much, Dr. Silverberg. So I'm going to ask Dr. Zemek and Dr. Robillard to come back, and Sydney as well, our amazing MC. Thank you so much to you all. These were fascinating. I think there were a lot of helpful tips and strategies and a lot of helpful information. Enjoy that it's backed by research, so appreciate that. So just we do have some questions, and I encourage people to pop more questions into the chat. Dr. Silverberg does need to leave at 1:15, or wherever you are in the country. So in 5 minutes. So I'll gear his questions first. But just a reminder, please pop your questions into the chat. Just this isn't a doctor's visit, so we'll answer generalized questions. And then this will be posted afterwards. So and if you do have any further questions, we'll post the link that Dr. Robillard put for her study, but then also the emails for Transcendent and for Brain Injury Canada in the post session email. So I'm going to start us off with, and I'll open this to you all, but could you speak a bit to post-concussion, persistent post-concussion symptoms? Is there a different strategy or a different approach that people should be taking for that? And perhaps I'll give it to Noah first, just because he does have to leave, and then we'll go in turn.
Yeah, sure. That's a big topic. I guess we're referring to when symptoms don't just get better on their own and they're lasting for longer than several weeks or a month. People differ in how they define this thing. But yeah, at that time, I guess the message is we can't just sit around and wait for things to get better, which I think is actually a reasonable approach in the first few days. But we want to go investigating some reasons why the symptoms are persisting. And that might be, sleep or mental health or other things that were mentioned today. And just being more proactive. Like now it's time to actually get connected with some health professionals, figure out for you, because it is different for different people, what is sort of at the top of the list as far as contributing to the maintenance of your difficulties and matching you to the right treatment.
Great. And Dr. Robillard? We'll go backwards this time.
Yeah, no, I totally agree with Dr. Silverberg. Not much to add. I think from the sleep perspective, of course, where it kind of there's more and more evidence across different conditions that if we do kind of address the sleep issues, then we might break the cycle and facilitate recovery. And that's things that we're starting to see, that those people who often tend to have more, more persistent post concussion symptoms also tend to have worse sleep issues as well. So it seems to go hand in hand. So again, I think that's an opportunity to then intervene and then see if we can get things better.
Great. And Dr. Zemek?
It's something that I'm really passionate about. One of the things I try to do in the emergency room is try to predict who's at risk of having symptoms last a long time. And I did a whole program of research into that. I think one way to think about answering it is even think about how the field has evolved and even our nomenclature. We used to call it post-concussion syndrome. Then we called it persisting symptoms or predicting post-concussive symptoms. Now, even the words we're using are persisting symptoms after concussion, or PSAC. And I think that gets to two things. One, it gets to the point that Noah made earlier. You could have this and you could have this, but the symptoms can't always be due to one or the other. The thing I say, though, is if I have a kid in my clinic or a kid in the emergency, we can call it hamburger. I don't care what we call it. I need you to get back doing the things you want and love to need to do. And so whether it is concussion that's causing persisting symptoms, something else that's causing it, we need to approach this to get you back doing as much as you can. and while you have whatever it is. And I think that's got to be one of those approaches. And I think that's where having a team help you. Each of us bring different expertise, and I think that's sometimes really important approach, because there's going to be no one pill or magic bullet to fix things.
Yeah, great. Dr. Silverberg, before you leave, I'm going to squeeze in one last question. How do people manage the fluctuating emotions and recognizing that day to day is every day is different, it can be different from moment to moment? What are some strategies that you would suggest?
Yeah, I guess the first thing is just to be kind with yourself about that and recognize that we're not all going to be even keeled all the time. Some fluctuation can be normal. Yeah, I mean, if it's getting to a point where it feels, out of control, it's interfering with your ability to concentrate and sleep and, other kinds of daily activities, that's the point where you probably need to do more. Yeah, so I mentioned there are circumstances and times where getting connected to a health professional with some mental health expertise is the right move. For many people, that might not be necessary. And yeah, I mean, there's a long list of kind of strategies that people can do on their own. But I start with the things that were covered today in terms of just taking care of your health more broadly. Um, yeah, trying to get sleep, maintaining social connections, moving around, getting some physical activity. And then beyond that, there are some great self-help resources in terms of like websites or provincially funded programs that differ a little bit depending on what province you're in or even what region. And so starting with your family doctor is probably a good place to get some ideas about what those resources are in your area.
Great. Okay. Thank you so much for being here. We know you have to leave, so I really appreciate you being here. Thank you.
Thanks, everyone.
So here's the question, and recognizing that you guys don't have a crystal ball, but can you speak to the recovery time? How people want to know how long they're going to be living with this, and we can't tell the future. We don't have that. So there's no magic bullet. But what can you say about expectations around recovery time? And maybe Roger,
Sure,
Dr. Zemek,
maybe
first.
I'll, sure. Call me Roger. It's totally fine, Michelle.
Okay.
Uh,
Okay.
so I'll use the data that I'm very familiar with in pediatrics, because it's how well people do. You also have to recognize, how has this data from science been collected? If I'm going to give the information of people who came to emergency departments and got enrolled in a big study across 9 centers, and we followed those kids for months. And so these are kids, just big picture, they got enrolled within about 2 hours of their injury, was the average time. And so how do those kids do? We know in big picture about 50% of people will still have symptoms at 1 week, about one in, about just over half. By 2 weeks, it's about 40%. By 1 month, it's about 1 in 3. But then it starts to slow down. Unfortunately, we know that by 2 months, it's about still only 1 in 4. And still, even at 3 months, it's still sometimes 1 in 5. We do know that older adolescents, sometimes girls, people with history of migraines, some of those people can be at higher risk. So all the hope that our team is doing, and others, is let's bend that curve. There is no real answer to what's the right amount of people who have them long term, because we don't know of all those people who haven't shown up to emergency department, who haven't shown up to their family doctor. We know when we look at people who have shown up to concussion clinics, and their first visit is a year in, the that data is dire. I mean, that data is showing that most people aren't getting better even longer term. So the whole point is, we need to do things early to help optimize that. While it hasn't answered the question exactly, I think that shows us that there's more work to be done. We can do better, and all the things that we learned today can really hopefully help, at least putting that brain in the right state to heal, such that when we get new treatments, they can work even better.
Great. Okay, Dr. Robillard, I've got one for you. Is there any evidence surrounding the use of melatonin for those living with concussion or PSAC, I guess.
Yeah, that's a good one. There unfortunately isn't a ton of studies on this, so I would have to say that's the bad kind of scientist response. But I think we need more research. The studies that I have seen so far are rather inconclusive, and I would say based on and that's specifically in the context of concussion. But if we take a broader scope, we know that, for example, in the general population, if we look at insomnia, for example, people who have certain types of insomnia might respond better. So I don't want to say just it's a bad for everyone. I think if you're, experimenting with it and you feel like there's some benefits, by all means, that's a good thing to continue under the care of your physician. But from what we know in terms of other population, for example, those people who notice that there's this kind of underlying issue behind their sleep problems linked more to the biological clock, because melatonin is basically this natural hormone that our brain naturally kind of secretes to help us fall asleep and stay asleep. So if you find that you sleep okay, but just you struggle to sleep early enough during the daytime, then it might be a good idea to take melatonin to kind of get your brain to secrete its own melatonin and kind of realign the biological clock. So basically, melatonin, oftentimes people think of it as a sleeping pill. It can sometimes serve that function, but that's the bit that's a little bit more blurry and there's not enough science behind it. But there's more evidence to suggest that melatonin can reinforce the biological clock. So I guess my answer is it would kind of depend what type of sleep issues you might have.
Okay, thank you. So Sydney, I'm going to pass this to you and also Dr. Robillard and Dr. Zemek. But the role of loved ones in recovery. So Sydney, from your perspective, you talked about your sweet mom. But where can loved ones, what is their role in supporting, and also where can they get help? How do they look after themselves? So Sydney, I'll pass it to you first.
Yeah, that's a really good question. My family was a massive part of my recovery. I actually moved back in with my family, which I was really grateful to be able to do. Um, in terms of their role, um, it was a bit tricky to figure that out at first, for sure. But really what I needed from them was just for them to be there, to be hopeful when I couldn't be hopeful for myself, to encourage me to keep taking all these actionable steps that I really needed to do to get better. And it did help me a lot. And also making sure that the kind of caretaker or whoever your family members or partners, people who have been impacted, um, making sure that they have their own support systems beyond the concussed person as well. My partner and I, we have gone to couples therapy together to have some of those hard conversations about how our relationship has changed, and it's been amazing. So I just really suggest just reaching out to whatever you have available to you, whether it's a counselor, a friend, another family member, or professionals in the concussion field.
Great. Thank you. Either you guys have any suggestions for loved ones, caregivers? Perhaps, yeah.
I mean, as a pediatrician, it's parents similar to what Sydney had talked about. And I think it's that Sydney said it herself, that positive reinforcement. There's been a lot of science, even using advanced neuroimaging. When you use positive framing and rather than focusing on, oh, is this going bad? Is this going bad? Even asking simple things like, hey, what's gone well today? Hey, you did this today. Good for you. You did this. You got to school for a part of the day rather than focusing on the negative, I think is a good tip in general for families to support their loved ones. And I think the other thing is think about things that the family knows going to promote healthy lifestyles. So yeah, again, maybe say, hey, let's go, and it's going to benefit the whole family. Let's all go for a walk together. Getting that fresh air, that exercise, reset the clock, and having that family maybe support that person who may not. They may need a hand up to get them motivated to do the things that the family may know is going to be good for them, or support them to, you know what, it's okay. I know you're going to have a headache, but try to get to school for a little bit longer tomorrow.
Yeah, it's great advice. And Dr. Robillard, anything related to sleep?
Yeah, well, from a sleep angle, I think we're a bit behind in that field, that there's more and more recognition that, as people are battling with sleep issue, that the support from the family is so important, and from partners, and oftentimes partners are also bed partners. And so there's all other dynamics going on there. And I hear so often people saying that, the either the kind of the partner or the pets in the room are, kind of great support perhaps, but at the same time kind of disrupting sleep. So I guess from that perspective, I would also encourage people to really do what is necessary, especially during the acute phases, because your sleep might be more fragile. So if you might need, for a couple of weeks to maybe kind of sleep in a different environment and in your own bedroom separate, then this should be a discussion with the whole family as well to kind of help get support and facilitate that. But yeah, I couldn't agree more with what Sydney's been sharing, and Roger as well.
Yeah, we know brain injury doesn't just happen to the individual, it happens to everyone around them. So those are great suggestions. So each of you mentioned exercise as a benefit. Are there studies that show what type? Because we've got some people who may have been, elite athletes, or, they run marathons on the weekend. What does research say after concussion? What type of activity is suggested? And we'll go to you, Dr. Zemek.
Yeah, so there's a great article for any of you who want to know how it works. Dr. John Letty, who's a member of Transcendent as well, has written an article on exercise as medicine for concussion. And he also recently wrote an article in the New England Journal talking about the importance of exercise, just in a case vignette following a journey of a teenager through their recovery. So in general, exercise should be aerobic. So the answer I say is your brain needs lots of good stuff. And so by pumping exercise, your brain gets more of the stuff it needs. It needs oxygen, it needs the salts, it needs the sugars, and exercise sends the good stuff to the brain. Rébecca talked about in sleep how the cleaning up of the breakdown products, so that when the brain gets injured, it has breakdown products, kind of like you do a construction product and you got to clean up the garbage. The body has cells, they're called glial cells, that clean up the garbage. And exercise, similar to sleep, imagine you did some cleaning up and your hands are dirty and you put it under the sink and it's drip, drip, drip. So it's going to take a lot longer to clean those hands. And more exercise and blood flow not only sends the good stuff up, but it flushes the bad stuff also way faster. Concussion also releases things called BDNF, which is a protein that actually heals the brain. And we had talked about the sleep. Another thing we didn't talk about is, and it ties into Noah, and I know he stepped away, one of the major causes of concussion symptoms, and where those intersection of mental health and concussion overlaps, is what's called autonomic dysregulation. And that's when people live in fight or flight. People have been wired for thousands of years to run away from the tiger. And what you're supposed to do is run away. Well, by doing aerobic exercise, you're doing what our bodies have been wired to do for tens of thousands of years. So there's lots of reasons, and of course the sleep benefits and others. So that's that. And that's why things like lifting weights may not be as helpful early. Not that it's not good to be healthy and strong by those other types of exercise, but it's really the blood flow is the key one.
Great. Dr. Robillard, anything to add?
Yeah, that's very interesting, because in the sleep field, that's the message that we've been drumming for decades, that the kind of anything that gets your heart pumping is key. And I think that this is still the case. That very recently, as in I think last year, there's been some studies starting to show that some of the weightlifting or other types of stretching, other types of exercise might also have some benefits for sleep as well. Now, how this kind of pans out in the context of concussion, like if you have to choose, I would still go for some exercise that would involve some aerobic kind of fine-tuning of your body, because that you'll get kind of a double bang for your bucks if you want. However, if this is not accessible or you want to do more, I think from a sleep perspective, there's now more recent evidence that suggests that any type of exercise is actually good. So I think from my perspective, it's also try to find something that you actually enjoy and that you'll be able to kind of easier put in practice on a regular basis, because motivation is also a key point.
Yeah, that's really helpful. All right, we got 2 minutes, and this is a question that's been sort of, we've got lots of questions, and we're not going to be able to answer all of them. So we'll see what we can do to maybe answer some of these post webinar. But we've got people that have tried everything. They've tried, every vitamin, and for headache, for example, they've tried everything. They are at their wits' end. What's next? What do they do next?
Michelle, I think that's such an important question. And I think that's why groups like yours exist, because and we've heard the story of how someone like Sydney shared with, and you get to that wit's end. And I think the short answer is the hard one. There is no magic answer. We're gonna have to be better at figuring out precision care. What is the exact things? And that's what doing this large, massive studies of thousands and thousands of people, such that we can find the 46-year-old person who was in the car crash, who has this and has migraine. That's the right treatment for that person because of all this science that we've done. I think the pragmatic answer is going back to what we talked about earlier. Get back to as much of your life as you can, because chronic symptoms are not unique to concussion. There's people with chronic gastrointestinal symptoms, chronic pain from other illnesses, people with cancer whose lives have been affected. And the lessons across all of those are try to live the best life as you can and try to do a little bit more every day until we, as science, until we do a better job in getting everyone back to doing the best lives they can.
Great. Dr. Robillard, and then Sydney, I'm coming for you.
That was terrific. I don't have anything else to add aside from the we from my perspective also includes people in the audience, as in we want to kind of work together to kind of get your input and find some solutions. Yeah.
Yeah, thank you. And Sydney, you've been there, done that. From your perspective, what, did you reach that point, and what strategies did you use to get past that? Or did you get past it? You may not get past it, so.
I definitely hit that point, and along with what the others have already said, I would just suggest that that's a good time to be reaching out to your community and finding people that have experienced concussion, and just being together in that, because sometimes it is a hopeless situation. Things do get better, but it's hard to kind of see the light at the end of the tunnel when you're really, really deep down in the thick of it. So for me, that is when I needed my people, I needed my community, I needed my family, and I needed other concussion survivors that I could relate to.
Great. Well, that hour and a half went very fast. Thank you all so much. We can't thank you enough. And thank you for everyone for attending and for all the amazing questions. We will endeavor to find a way to answer these, but it also gives us really good ideas for future webinars and future education materials. So I can't thank you enough for being here. Please take a moment to fill out the feedback. It helps us figure out what we're doing right, what we could improve on, but then also we ask for future topics because we're doing this for you. We want to know where you want to learn, what areas are most important to you. So please do take the time, and a link will be sent after this an email will be sent after this with this link. We'll also include Dr. Letty's, that sounds like a great resource that Roger mentioned. So we'll include that. It'll also have the link for Rebecca's study, because it sounds like lots of people in the questions for asking for that. But thank you all so much for being here. The recording will be posted. We'll send the link out, and we look forward to seeing you all at the next one. Thank you so much.